I am Dr. Lawrence Smith, Dean of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Thank you for tuning in to Well Said. In a culture of community, scholarship, and innovation, the Zucker School of Medicine is dedicated to transforming students into doctors who will improve healthcare, inspire change, and better the lives of the people they serve. It is why we are pleased to collaborate with WRHU Radio Hofstra University to bring you a program committed to sharing expert discussion and insight on health and wellness topics important to you. Join us today and each week for a recommended dose of Well Said with your host, Dr. Ira Nash.
Hello, I'm Dr. Ira Nash. Welcome to Well Said. Today we'll be discussing how to best prepare for surgery. Surgery can be very intimidating and anxiety-provoking for patients and their families. In today's episode, we'll try to demystify surgical procedures and explore the kinds of questions you can ask your physician and healthcare team before you have an operation. My guest is my colleague, Dr. Elliott Hershman. Dr. Hershman is the chairman and James A. Nicholas Chair of Orthopaedic Surgery at Lenox Hill Hospital, and I'm delighted to welcome him to Well Said.
Thank you, Ira, and thanks for the invitation today to join you.
We are just past the 1 year mark of really an extraordinary year in medicine because of the pandemic. How have you been holding up?
Holding up well. I'm happy to say that I'm vaccinated fully, as is my whole family. We're feeling significantly better. We still are being careful, but are moving our way back into society, so to speak. In terms of my department at Lenox Hill, we have been doing, of course, throughout the entire pandemic, continuing to care for patients, particularly with emergency conditions. But we're back doing elective surgeries, and our department activity is back where we were pre-pandemic, although we are still doing some remote-type activities. So all good and certainly moving in a positive direction.
Well, glad to hear that. So we're going to spend this afternoon talking about surgery, but let's start with kind of what makes surgery special. Why is that different from kind of more routine medical encounters or even what we consider medical procedures?
Surgery is an event that affects your physiology, your body, in many ways, and because of that, we take surgery very seriously, and we always want to think about all the areas of impact a surgical procedure could have on an individual. There are some minor procedures that don't have much impact at all, and surgeries vary from minimally invasive procedures that are done on an outpatient basis and recovery is relatively short, to major surgical interventions that are done through open means, require extended hospital stays, and long periods of recovery. So, surgery, there's a wide gamut of surgeries, and it's important to understand each of them and what exactly is involved in those procedures and how that differs from any, sort of other procedures that you have been through or contemplate or think about when you're trying to evaluate a situation with regard to your health.
So you mentioned that surgery can have kind of an impact on the body beyond just kind of fixing the thing that needs fixing, which is why you're having the surgery in the first place. Can you give us a sense of what some of those impacts are? Like what exactly are we talking about here?
First of all, surgery involves an incision. There's a scar. You have to have anesthesia. There's lots of medications that go into your body. And that affects people in different ways. There's an emotional component to having a surgical procedure. There's some psychology involved in how you recover, how well you respond to stress. How is surgery going to impact on your family? How is it going to impact on your vocation, work, your activities of daily living? These are all parts of what you need to think about when you start to take the path of a surgical solution to a problem that you may be experiencing.
So let's talk a little bit about that decision about going forward with a surgical procedure. Many people, when they're faced with the decision to have an operation or not, feel compelled to get more than one opinion before they make that decision. Are there some guidelines that you can offer our listeners about when you think it's a good idea to get more than one opinion about whether surgery is the way to go?
When patients ask me, should they get a second opinion, my answer always is yes. Because I think that, a second opinion can do a number of things for a patient. First and foremost, I think when thinking about surgery, there's really two parts to coming to a level of comfort with going ahead with a procedure. First is information gathering, and second is decision making. And so you want to feel as though you've gathered all the information that you can, and a second opinion can help you with that. There's lots of alternatives to surgery. You want to make sure that you've exhausted those alternatives before you proceed with surgery. And you want to make sure that if there, is not an alternative, why? So I think that, as you gather information, asking other individuals their opinions and learning about the problem at hand, as well as some of the various solutions that people can offer, makes incredibly great sense to me.
You said the other part was the decision making. So distinguish that a little bit from the information gathering.
First you need to do information gathering. So basically you want to know all the different parts of, number one, what's your problem? What's your diagnosis? And you can learn about that, as many people do today, online. But you need to be really careful about where you look. For example, you want to look at things like the Cochrane reviews. You want to look at, the information available through medical schools, through you can do a search on Google Scholar, and I would be more inclined to be on Google Scholar rather than just on Google, because you'll get information that could be in a peer-reviewed journal that may be more valuable and more accurate. And if you can, and you can find things like systematic reviews where they pool information, and you can learn about the risk, the rates of success with different treatments, the risks of treatments, and that applies for both the non-operative and the operative approaches to different problems. So you want to understand, number one, what's the natural history? What's going to happen to me with this problem if I don't do anything? And then if I do take a path with a treatment, and if it's surgical, what are the potential outcomes? What are the risks? What are the benefits? What can happen? Can I have a recurrence? There are lots and lots of questions that you can ask along the way in terms of information gathering. And then once you have all that information, it's about decision making, which is the second part of this. And then, you take all this information and hopefully you make a really educated decision.
So let me pick apart a piece of what you just said, which is this notion of trying to understand the risks of surgery and the likely outcomes. Of course, that's an important piece of this, but what about the fact that not all surgeons doing the same procedure have the same outcomes? Meaning, isn't it the case that some surgeons are better at some things than others?
Well, let's put it this way. Some surgeons are more experienced than others. And I would say to that, you definitely should seek out a surgeon that has experience in the procedure that you're going to undergo. That's for sure. No question that surgeons specialize and subspecialize. And you want to ask a surgeon, questions you want to ask are, what is a surgeon's experience with this procedure? And what are the risks involved? What are the common risks? And what's the most common risk? For example, in that surgeon's own experience with the procedure they're going to perform. What are some of the rare, significant risks that might happen? And no question, you want to be with a surgeon that is experienced and has a good grasp of the surgical procedure that you're going to undergo.
You know, as a physician myself who refers patients to surgeons for different kinds of surgical procedures, I often counsel patients to make sure that they feel good about the surgeon who's operating on them, that they develop a certain connection with that surgeon. Do you think that's good advice?
I do, absolutely. And I actually give that advice to my patients as well. When people say to me,
good.
how do I decide on who should do my surgery? And this happens to me frequently because although I take care of patients with knee issues, my subspecialty is doing sports medicine and doing ligament surgery and meniscus surgery in patients, or so-called arthroscopic surgery. But I see lots of patients with arthritis, and many of these people I recommend that they consider at some point a knee replacement. And the people ask me, how do I pick a knee replacement surgeon? My answer is twofold. Number one, find someone who does lots of knee replacements. And number two, find someone you feel comfortable with. Those are the two most important elements of a patient's decision and process about where and when and with who to undergo surgery.
I've always been impressed that I think there's a deep psychological issue at play here. I think patients actually do better and recover faster if they have a lot of faith in the surgeon doing the operation. What do you make of that?
I think that's true. I think that, patients... So I think that patients want to feel that their doctor cares about them, that their doctor is experienced, and that they have confidence in what their physician is telling them and recommending for them. And I think that bond helps definitely with recovery and with the whole process. The whole, we call it about, sort of the patient experience. I think you're absolutely right about that, Ira. That bond, that level of comfort plays a big role.
Yeah, I'm just struck as I think about this, how evident it is how much our state of mind affects our state of health. And so to me, there's a really good reason to put your hands in yourself in the hands of somebody you trust. I think that just reinforces all of those positive things. So let me go back to something else we were talking about a minute ago. I think you laid out very nicely the kinds of things that people should be thinking about, asking their surgeon about, maybe asking a second surgeon about around their candidacy for an operation. I want to flip it around a little bit and talk about your perspective as a surgeon considering somebody for an operation. And I know you're an orthopedic surgeon and you do knee surgery, but I think this is kind of a generic question for surgeons in general. What are surgeons looking at in the patient across the table from them to say, oh, well, this is somebody who is going to do well with surgery, or this is somebody who is not going to do well with surgery? And I know it depends on what kind of surgery we're talking about, but to the extent that there are some general issues here, what might those be?
So first of all, as a surgeon, I like to use data as much as I can to guide my decision-making with respect to selecting patients for surgery. Because, on my side, I'm the one that's going to recommend surgery to someone. And I have to be comfortable saying to them, well, I think an operation is the right choice for you. And I want to use data for that. So I want to use information in the literature that says a person with these findings, if they have this procedure, this is what the outcome will be in the majority of cases. So that's the information that I'm going to use in my thinking, in my sort of assessing an individual as a candidate for surgery. In general, for example, we want to optimize patients as well, and make sure that they're in the best place they can be for surgery. But when I think about patient selection, it's about identifying what the problem is and making sure that what I have in my sort of toolbox in terms of a procedure fits what the diagnosis is, what the pathology is, what their anatomy is, and I can say to them, well, with your situation, I can tell you you'll have a 90% chance of full recovery, 5% chance of incomplete recovery, but this is what we can expect. And then there's a 5% chance of being the same afterwards or having a problem. And I'm basing that information on data that has come from multiple studies over the years that in my situation, orthopedic surgeons have done on patients with similar conditions.
But certainly, and I respect that, and I think that's a great way to approach that, but aren't there different kind of risk factors for surgery? I'm thinking about, people who are older or smokers or who have other medical conditions. How do those things play into your decision making and your advice?
Yeah, so today we talk about optimizing patients and making sure that the patient is in the best shape they can be to undergo a procedure, particularly an elective procedure. And so number one, we talk about smoking, because we know that wounds don't heal well in smokers, that bones, don't heal well in smokers. So we want people undergoing elective surgery stop smoking, and we refer them to a smoking cessation program. Alcohol, another thing that impairs healing. Weight can be an issue. We know that for hip replacements, knee replacements, excessive weight, there's a higher rate of complications. We know that anemia can play a role. Patients' sort of general health status in terms of, how well they've been eating and what's their nutritional status. Diabetes. We know that diabetics, if it's uncontrolled, they have a higher rate of infection. So we take all these factors and we say to folks, please, here's what you have to do. Here's a list of things you need to change and help yourself so that if we go forward with an elective procedure, we can optimize the situation so that the risks associated are as low as they can be. And all of those things can impact, certainly, your outcome.
And I'm sure many folks listening are familiar with the concept of, it's a term I don't really like, but it's a commonly used term for preoperative clearance. This idea that you have to go see your primary care doctor, or in some cases a cardiologist, before you have an operation to get like a stamp of approval to say, yes, you're in good enough shape to go to the operating room. What you're talking about sounds like a much more subtle and important process. Could you just distinguish those two a little bit more, the clearance versus optimization?
They go hand in hand, Ira, because, really, when you go for a clearance, we're hoping that at the time of a clearance, we're going to partner with the internist, the cardiologist, or who's ever doing the clearance, so that as a team, we put the patient in the best situation as they can be metabolically for undergoing a procedure. So if the clearance, we ask for blood work, we ask for cardiogram, sometimes for a chest X-ray, sometimes for a urine analysis, and much of it depends on the age of the patient and the patient's health status. An 18-year-old undergoing, an arthroscopic procedure or some type of elective surgery is really different than a 72-year-old, undergoing, major back surgery for spinal cord compression. Completely, different situation with respect to the surgical procedure and the health status of those individuals. So the preoperative clearance is about checking some of the boxes and making sure that these particular measures are okay. And if they're not, then the next step is to optimize those patients and make sure that we can get those values as close as we can to where they need to be for the surgical procedure to go forward and be successful.
Yeah. So I like the way you frame that as in terms of kind of doing a more comprehensive assessment, not just of the needs of the patient with regard to the surgery, but the needs of the patient with regard to their overall health, and in getting all of those ducks in a row before somebody goes to the operating room.
Yeah, and I think it's really, really important. And we know from the procedures, from the outcome work that we do on our procedures, particularly more major procedures in the older populations, that optimization plays a big role in reducing the rate of complications.
We should state what may be kind of obvious if you think about it, which is all of this applies only for people who are having elective surgery, meaning surgery that is scheduled at some time in the future, as opposed to somebody with coming into the emergency room with something where surgery may be an urgent or immediately life-saving intervention.
Right. And to your point, you're spot on. We look at it sort of in three buckets. Emergency, meaning you hit the door to the emergency room and you're on your way to the operating room in no time. And that's, a life-saving event. Not much room there for optimization, but a little bit. As compared to an urgent.
And in your field,
example, what urgent would be like.
Yeah, what would be an example of something like that?
Yeah, a hip
I'm
fracture. A hip fracture.
Okay.
So someone, broke their hip or fractured their wrist, and that's in my world. And, we have a 24 to 48-hour window to get that accomplished. We don't want to send the patient to the operating room with their diabetes completely out of control. So we'll take 24 hours and manage that with some insulin and some medication to get their sugar where as close as we can where it should be when they go to the operating room. And we'll use our colleagues in the hospitalist program, to help us with that. So for urgent cases, even in that situation where we have a 24 to 48-hour window, we'll optimize those patients. And in elective, there are studies that show on many of the conditions that we treat, waiting does not affect the outcome. So, for example, if you have arthritis and you're going to have a hip replacement, giving yourself a month or 2 or 3 to lose some weight and get your sugar in control and stop smoking, all of those good things to make your recovery smooth and avoid complications, take the time, take those 3 months, take those 4 months, and get that accomplished before you undergo surgery.
Right. So it really does make a big difference. The sort of urgency of the surgery really creates either a short or a longer window for all of those good things to happen before somebody gets to the operating room.
Absolutely.
One of the things that I think people are used to being told is they should come to the operating room on an empty stomach, right? So don't eat anything after midnight the night before or after dinner the night before. Can you just explain what that's all about?
Sure. In the past, it was always felt that people should come to the operating room with an empty stomach so that under anesthesia there was less risk of so-called aspiration or food coming up from your stomach going into your lungs, which is a serious complication. It turns out now, and we've learned through a number of studies, and the anesthesiologists have taught us all about this, is that actually drinking fluids up until 2 hours before a procedure is really helpful in terms of your overall metabolic state when you get to the operating room. So for many procedures now, we have a program called Enhanced Recovery, where we let folks have a light meal 6 hours before surgery and have them do some carbohydrate loading with liquid carbohydrates up until 2 hours before the procedure. And this helps with postoperative nausea and vomiting. This helps with a number of the metabolic measures that are important in recovery. And it also helps us reduce the length of stay, since people feel better after undergoing a surgical procedure. And there are other parts to enhance recovery, including using like a regional anesthesia, where we either give people like epidural or spinal if we can, making sure we give them some medications before surgery to help reduce with pain afterwards, try to eliminate as much the nausea and the vomiting that might occur after a surgical procedure, and getting them out of bed, getting them moving right away. That's really important. And this is all part of this enhanced recovery. But, going back to your question, we know that what we do right before the procedure in terms of fluid balance and carbohydrates and where you are metabolically plays a really important role on where you are, when you wake up from surgery. And I would say to everyone, make sure you talk to your surgeon about enhanced recovery protocols or enhanced recovery programs, and where your surgeon, stands with respect to those, where the institution is, because that's a team approach, meaning anesthesia, nursing, the surgery, the post-op people. Everybody has to be on board for those programs to be effective, and it's an institutional initiative. So, ask about that when you have those pre-operative meetings with your surgeon and your surgeon's team, the PAs, the office people, to find out as much as you can about those clinical pathways that your surgeon may be participating in.
I'm struck by the fact that so much of what we've been talking about is careful preparation for the operation. I mean, everybody expects the surgeon to be prepared. We hope you know what you're doing, and, you got a good night's sleep the night before, that kind of thing. But I'm really struck by how much of our conversation has been about getting the patient not just medically optimized, but really kind of finely tuned up until how much you've had to eat, how much you've had to drink. All of those things seem to have an important bearing on how the patient recovers from what I suspect is a wide range of interventions, right? We're not just talking about orthopedic surgery here.
Absolutely not. In fact, the enhanced recovery program started out, in cardiac surgery, I believe, and now, we do them in GYN surgery, in general surgery, and there's been lots of changes to the preoperative preparation, and it truly is a partnership between the patient and the surgery. And that goes back to your point, before, about being comfortable with your surgeon, and making sure that you can have a conversation with the person that is going to do the surgery. I mean, you're going to find a surgeon that has the experience. That's going to be part of your due diligence, before you undergo a procedure. You're going to have exhausted all the non-operative things that you could partake in before you undergo the procedure. So that's done. The rest now that we're talking about, making sure you're with somebody that is doing some of these protocols and it's appropriate, and is involved with an institutional team that can really, really facilitate your recovery.
Well, Elliott, that seems like a great place for us to end our conversation. I want to thank you so much for sharing your insights today.
It was really my pleasure. It was great to talk with you, as always.
For more information about this program and to find past episodes, please visit sites.hofstra.edu/wellsaid. You can also subscribe to our free podcast available on Apple Podcasts, Stitcher, or wherever you get your podcasts. Our listeners are welcome to send comments, suggestions, and questions to wellsaid@hofstra.edu. Until next time, I'm Dr. Ira Nash, and that's Well Said.